Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm your host, Stephen Newmar, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Well, it's been quite a week, quite a month, quite some times in the healthcare advocacy world and the health policy world generally, and generally for our country. So the number one word, I think, if you were to do a Google search in the past week, 2 weeks, has been the word tariffs. Tariffs are everywhere. You probably read about them every hour, even if you're not trying to. At least I do. And I'm not even trying to at this point. But put succinctly, our country enacted a lot of tariffs. I'm actually not even going to attempt to get into the specifics of what happened and what was rescinded because there have been so many and it's difficult to keep up. And I am going to necessarily fumble and not get it all accurate. Not to mention, by the time we finish recording this episode, things may have changed. And I'm not exaggerating when I say that. That's how fast things are moving. But in a nutshell, we had tariffs imposed on nearly every country in the world, nearly every country that we do trade with. We imposed large tariffs last week. Those tariffs were essentially rescinded towards the end of the week, with the exception of a 10% tariff across the board on all nations, as well as a very large tariff on China by the end of last week. We're recording this on Monday, April 14th, just to level set. So by the end of last week, we had a large tariff imposed on China. At one point, it was 84%, then it went up to 104%. And again, I should not get into the details because I'm going to get some wrong. But the point is, we essentially got to the point where we're in a full-fledged trade war with China, if not close to an embargo of China versus the United States. At one point, President Trump announced an exemption for trade dealing with electronics and phone devices. As most folks are aware, a lot of electronics, including on nearly every phone that's used in the United States, is manufactured in China. Imposing a 104% tariff would really raise the price on what I personally consider not to be very cheap products to begin with. So that would cause some disruption for folks needing phones, which is basically every adult human being and beyond in the United States. So there was a carve out. And then on Sunday, President Trump sent out a tweet saying that there is no carve out, that they're part of a different set of tariffs, something having to do with superconductors. It's very convoluted, but it's a long-winded way of saying we are now in a full-fledged trade war with China. The rest of the world, as I mentioned, we put a 90-day pause. I didn't mention the 90-day part. We put a 90-day pause on tariffs elsewhere. But at the end of those 90 days, we don't know what's going to happen. Number one. Number two, we don't know if the president is going to change his mind before those 90 days and impose additional tariffs on those countries. It's very shocking to the system, to say the least. Quite frankly, it's not really the way we're used to doing things in a democracy. Tariffs are generally set in our nation by the legislative branch. That's not what happened here. They're being set by the president with the approval of the legislative branch, but the president keeps moving and changing tariffs, which is causing consternation, to say the least, for a lot of folks who like to buy things, which is pretty much all of us, as well as a lot of folks who have money invested in the stock market, which is a lot of folks. So that's where we are. And how does this relate to healthcare and health needs and health policies? Well, we do import a lot of goods. We import medical devices and a lot of pharmaceutical products. A lot of our drugs are imported from other jurisdictions, of course, including most notably China. Now, President Trump has said that pharmaceutical products are currently exempt from his tariff plan, but that they, quote, are coming soon. Tariffs are coming soon to pharmaceutical products. So obviously, if you're anyone listening who takes a pharmaceutical product, which again is mostly every American, I know I go to CVS quite often just to collect my Tylenol or Advil or whatever the heck else I need, or stomach medication. If it is produced overseas, these are going to get hit with tariffs at some point in the future. And we will have to see the specifics and the particular drug product that you use. The same goes for medical devices. If you are a user of medical devices, even simple ones such as crutches, perhaps, that are manufactured overseas, the tariff could certainly impact you. So just to recap, tariffs on medical devices and other products for consumers could push up prices for healthcare providers that potentially impact the availability of essential equipment and supplies. This means that your local healthcare provider may have less supplies to go around. If you're visiting in person to see a supplier, it could mean that your employer, whom you get your insurance through, or your insurance carrier, may decide not to cover certain medications or may raise rates in response to these tariff costs. So that's how it could certainly directly impact patients. but indirectly the impact on all Americans, but patients in particular. If you start to feel a struggle financially in one side of your ledger, if you will, that could have an impact on how you proceed with medications. If you're struggling financially, if there are pressures at your job, if you unfortunately lose your job due to some of these issues in the marketplace, that could necessarily have an impact on your mental health, which of course can translate into an impact on your physical health as well. So look, these are things that we will continue to look into. I actually am doing my best not to read the word tariff in my own personal life. However, it seems as though I can't pick up my phone without seeing the word strewn about somewhere. So we're all living in this world. As I said, it's not the world we were living in a few months ago, but here we are. And we'll see how it impacts patients and what you can do in terms of it. I joked to some friends, it's time to stock up on iPhones now before the prices really jump. Fortunately, I wasn't the only one who made that joke or less joke, because it turns out that the prices have skyrocketed already in anticipation. So anyway, I have no other advice. I'm not an economist, and I'll leave it there. So we will try our best to navigate these tariffs together. Moving on, other news this week. So we've talked a lot about some of these cuts that have been implemented by the Trump administration across government and through Elon Musk and his Doge office. So one I just wanted to highlight this week, they have essentially eliminated a pain research office that was part of the National Institutes of Health. They actually fired everyone except for one individual who I suspect will be repurposed elsewhere. It's called the National Institute of Health, their Office of Pain Policy and Planning. And this was eliminated just last week. And this was a unit which was devoted to coordinating pain-related research across the federal government. Advocates such as us at GHLF, we worry that crucial products related both to acute and chronic pain could essentially come to a halt. The office was housed within the National Institute of Neurological Disorders and Stroke, and its work intersected with that of numerous other NIH institutes and federal agencies. So that is a real-world example of something that patients look to, patients that deal with pain, which are many folks that we know who deal with pain regularly, and an office whose essential job was to look into pain policy and planning and help try and create a society that would be better geared towards helping folks navigate life with pain, has now been eliminated as a result of some of these cuts. And that's just a real world example to pay attention to. Moving on, it's yet another week where our HHS Secretary was in the news for vaccines. He actually started out last week speaking positively about vaccines in light of even more cases of measles, including a second death in Texas of an otherwise healthy child who was unvaccinated for the measles. The Secretary of Health and Human Services, Robert F. Kennedy Jr., said last Sunday that, I will quote, "The most effective way to prevent the spread of measles is the MMR vaccine," unquote. He posted that on X, and that was his most direct statement yet on the issue of vaccines and with specificity to measles. He did stop short of recommending vaccinations. He just said that it's the most effective way to prevent the spread of measles. And then later, he actually posted again on X, this time to promote what I will charitably call unorthodox, unproven treatments for measles. And I'll get into that in a moment. Then later in the week, on Thursday, RFK espoused the idea that respiratory vaccines targeting only one portion of a pathogen don't work. He made this claim in an interview with CBS News, and when pressed on why political appointees at the FDA delayed granting full approval to Novavax's COVID vaccine, he used it as an opportunity to essentially say that these vaccines targeting only one portion of the pathogen don't work, essentially. And just as a reminder, the original COVID-19 shots targeted a single protein, and they proved to be highly effective in the use against COVID. The same is true for a new class of vaccines that is targeted against RSV, but of course, this could have significant implications for the development of new vaccines when the big boss at HHS is espousing such things. He also, as I mentioned previously, he promoted the idea of unorthodox treatments, and those treatments specifically for measles, he mentioned cod liver oil and vitamin A. These are unproven. In fact, I did a pretty healthy search, no pun intended, and I could not come across one peer-reviewed study looking at vitamin A or cod liver oil and its effects on measles patients. So the idea that one should consider using cod liver oil in lieu of taking vaccines is unfounded, to say the least. And I just want to take a personal moment to say the idea of promoting such things is dangerous. I have friends and family members who will say, well, what's the harm? What's the harm in just having a little cod liver oil? Or what's the harm in having vitamin A? And the harm is simply this. Number one, you're putting something into your body and you don't know its effects. And you're oftentimes, when you do that, you're not informing your medical provider. You're not informing your doctor. And there could be interactions that taking higher doses of vitamin A or cod liver oil and with other medications that you're on. Another obvious issue is if you're taking these medications in lieu of taking medications that work, then you're putting yourself at risk for obtaining the disease and also not eradicating the disease from your body and thus spreading the disease. If I were to say for the common cold I have, or for a flu, a cure would be to hop on one leg for 10 seconds and then that could help cure the flu. Is there a harm to doing that? Well, I guess technically in that situation, no, there's no harm per se. But if you think that doing that is curing you and then you go out into the world thinking that you're cured, you're then spreading your illness to others. So there is an unintended harm that you may not be thinking of with some of these supplements. Also, when it comes to supplements and vitamins, it should be noted that they are not regulated with the same rigor that medications are. And by that, I mean specifically the actual products that you're buying from, the rigor in testing that what you're buying actually contains, the product that it says that it contains inside the bottle is not tested to the same rigor that actual medications are held to, not to mention in terms of their safety and efficacy for both short-term and long-term use are not tested the way the FDA tests other products. So those are things that you should keep in mind. And just as an aside, a lot of the vitamin products are found naturally in foods. And if you are obtaining more than enough vitamins from the food that you eat, adding additional vitamins may prove to be harmful in some instances, or may not, but certainly may prove to be unnecessary if nothing else. So those are just some things to keep in mind. And with that, I want to say before we end, if you're interested in hearing more about how the FDA works and some of these cutbacks might mean to the FDA, not to mention what we were talking about in terms of using unfounded medicine, definitely check out the latest episode of our sister podcast, Healthcare Matters, where there was a great interview with Peter Pitts, former Assistant Commissioner of the FDA, and he dives in a lot deeper into some of these issues. So I definitely recommend that. So with that, thanks for joining us here on The Health Advocates. It's always a pleasure to talk about what's going on, even though the subject matter is not always pleasant, unfortunately. It's great talking to you all, and we love hearing from you. And last, before we go, we have some big news for lupus patients. This week, we launched our Lupus Help Center here at GHLF. You could find that at lupushelpcenter.org. That's lupushelpcenter.org. And there's great resources for lupus patients to find information on your disease journey and living your best life with lupus. Stay tuned for more information, and we'll continue to pass it along. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.